It's wonderful to be able to join you virtually for Clean Med 2022, and I'm sorry not to be able to join you in person. The topic of climate change and health equity is vitally important, and so opportunities to connect with leaders like you to talk about the very latest in our work is greatly appreciated. If I had to summarize my remarks in one sentence, I would simply say that the time for discussion and deliberation has long since passed, and action is needed now to protect the people of this country and the world from the health threats associated with climate change. Report after report underscores the seriousness of the situation and confirms that harm from climate change is not a mere possibility in the future, but a day-to-day reality. We need to act collaboratively and urgently in response. History will look back at this moment and judge us for the actions that we take or that we do not take. That is why I am proud to serve the Biden administration with its clear call to action on climate change and its whole of government and whole of society approach to tackling this massive challenge. COVID-19 has shown us that public health is truly the center of the universe, and that is echoed in 5 of 7 of President Biden's immediate priorities: COVID-19, climate, equity, the economy, and healthcare. For the first time, healthcare is center stage. While we have the spotlight, we will use it to fuel momentum in every sector to take the swift and necessary actions to tackle the climate change emergency, including for our health systems. We at HHS are working hard to address climate change and its impact on both physical and mental health through a number of new actions in the department and through collaboration with groups like the National Academy of Medicine's Action Collaborative on decarbonizing the U.S. health sector, which seeks to mobilize private sector stakeholders to reduce emissions. We want to be bold in what we do and take concrete, rapid action to both protect the public from the catastrophic and chronic climate threats and to actually reduce the sector's carbon footprint. Now, we know that certain communities, often the same communities that have borne the brunt of the pandemic and long-standing environmental injustices, are at particular risk, and we must proactively meet their needs. A major signal from the administration on the importance of climate change and health equity was the establishment of HHS's Office of Climate Change and Health Equity in August of last year. OCHE, as we fondly call it, reports directly to me. It is an office with a mighty mission. This office was created in response to President Biden's executive order on tackling the climate crisis at home and abroad. The office has 3 main areas of work. The first area aims to build the resilience of communities to the impact of climate change, especially communities facing more than their fair share of climate change and environmental justice burdens. We will work closely with each HHS unit and with our regional offices to help tailor solutions that meet each community's unique needs. The second area focuses on harnessing long-term recovery and infrastructure initiatives to combine climate actions with health equity. We know that the environments where people are born, live, learn, work, play, worship, and age can either contribute to people's health and longevity or contribute to illness and health disparities. And those disparities then make people more susceptible to the health threats of climate change. We believe that OCHE has a role in working with and assisting other agencies in optimizing the health benefits of their climate change-related investments. Lastly, OCHE is working with our nation's hospitals and health systems, both private and federal, to reduce their greenhouse gas emissions and make them more resilient to the effects of climate change. The United States health sector accounts for roughly 8.5% of U.S. carbon emissions, and the global health sector accounts for around 4.5% of global carbon emissions. Thus, progress in this area is critically important towards meeting President Biden's goal for economy-wide greenhouse gas reductions by 2030. We like to think of OCHI as the glue that will hold all of these climate health efforts across HHS together. Through OCHI and through the leadership of Interim Director Dr. John Balbus, there with you today, we are taking a comprehensive approach to identifying every lever available to support change and to assist all of you as much as possible. One of the first enterprises for the office has been clearly signaling that climate, health, and equity are now priorities for HHS. In November, I had the pleasure of leading OCHI representatives and the U.S. HHS delegation to the United Nations 26th Conference of Parties, or COP26. There in Glasgow, we announced the United States' commitments to the COP26 health program to achieve climate-resilient, low-carbon health systems. This was a watershed moment when the health ministries of over 50 countries, including the United States, made formal commitments to address the health challenges associated with climate change. We committed to creating a healthier, more resilient, and more sustainable future, both for our healthcare systems and for our entire society. We've taken the additional steps of supporting the implementation of a new executive order on federal sustainability that mandates all federal facilities, including our federal health systems, achieve significant greenhouse gas reductions from energy use, vehicle fleets, and buildings. Of course, simply expressing our intent is not enough. We are systematically consulting with all of our colleagues across HHS, among them CMS, CDC, FDA, ASPR, IHS, HRSA, and SAMHSA, to make sure that we are introducing new policies and amplifying existing ones in service of these goals. We have developed a pipeline of policies that we think are promising and will collaborate across the department to roll them out in the coming months. Some recent highlights announced Earth Day include new data and forecasting tools from OCHI, ARC, and other federal departments to help anticipate climate challenges, new resources on climate change and behavioral health from SAMHSA, and almost $400 million in new investments in LIHEAP, the Low-Income Home Energy Assistance Program from the Administration for Children and Families, that helps families cover the energy costs required by extreme temperatures and other climate challenges. As noted, we are also actively working with the private sector, since the government alone cannot accomplish all that needs to be done, especially as so much of care provision comes from the private sector. I am very pleased to co-chair the National Academies of Medicine's Action Collaborative on decarbonizing the United States health sector for this reason. Made up of organizations from across the industry, as well as leading researchers, including several on today's panel, the collaborative is identifying priorities related to healthcare delivery, healthcare supply chain and infrastructure, and health professional education, as well as policy, financing, and metrics. It brings together really some of the finest minds in the nation to tackle this crisis. We are collecting great input through the collaborative and its associated network organizations, and beyond that, we have opened our doors to direct feedback from the healthcare industry through a series of requests for information. The most recent come from CMS as part of its notice of proposed rulemaking for its inpatient rule, and from our office regarding our planned environmental justice strategy. On this topic, we are particularly interested in your thoughts. We simply cannot properly address the challenges of climate change if we do not prioritize responses in communities that are repeatedly and relentlessly harmed by the confluence of discrimination, disadvantage, and environmental harm. I have seen firsthand how organizations, individuals, and caregivers work together to meet the health needs of their communities. I have seen what it takes to organize at the state level, and now what it takes to create change at the federal level. And having witnessed all of this and seen so much progress, I know that we can all work together to anticipate the challenges of climate change and create healthier communities. COVID-19 has taught us that we are all interconnected and we must work together to solve our problems. And that is why I'm calling on you today. I want to emphasize again that the government cannot do this alone. We need health systems to stand with us. Hospitals and health systems are major consumers of energy, water, and other resources. Improving efficiency and transitioning to renewable energy in your facilities is hugely important and symbolic as well. It shows that as guardians of the community's health, caregivers recognize the threat of climate change and will lead society in responding to it to protect their patients and their families. To do our part in the healthcare sector, we need to look at building a more resilient infrastructure, reducing emissions, spurring American technological innovations, and creating good-paying green jobs. Climate-friendly health systems, many of them here in the room with you today, embrace energy efficiency, green building designs, and alternative approaches to energy generation, transportation, food, waste, and water. We must also look beyond providers of care to other stakeholders, and particularly those active in the industry's supply chain. We know that the majority of emissions come from the supply chain, and so suppliers, pharmaceutical companies, group purchasing organizations, and others must step up and collaborate with caregiving organizations. As part of the Biden administration's commitment to climate action, federal health systems, including the VA and the Department of Defense, are already committed to reducing emissions and to achieving net zero emissions as directed by the Biden administration through Executive Order 14057. We are now acting the private sector to mirror these commitments. On Earth Day, we launched a pledge initiative to mobilize public-private action and secure explicit commitments from healthcare stakeholders to lead the country on emissions reduction. John will tell you much more about that today, but I simply want to give a hearty thanks to those of you who have already committed and to encourage others to follow suit. Please go to our website and take the pledge. We are accepting pledges through the end of May, and we will host an event at the White House in June to celebrate those who have joined in, creating a community of practices and introducing supportive resources in the months to follow. We are truly all in this together. Given the health sector's significant contribution to carbon emission and its role as a linchpin in orchestrating resilient responses to climate health threats, we are in a place to lead lasting, meaningful change if we are able to come together and act right now. I choose to take action. I choose to do all that I can to protect our health and our world's health for myself, my family, and my community. It is no longer a question of protecting future generations, but protecting our current generation. I sincerely thank all of you in the Healthcare Without Harm for your tireless work at the vanguard of this movement. There is much more to do, but your courage, your perseverance, your persistence and creativity give us optimism and energy. Thank you.